Hello listeners, welcome to Views on Health. Back with us tonight on the program is Dr. Pravin Wijesinghe, Consultant Plastic Surgeon, Teaching Hospital, Batticalow. A warm welcome, Doctor, because it's a long drive from the east to the west of the country, and we truly appreciate you putting in so much of effort to be with us on the program.
Thank you, Fatima, and a warm welcome to the listenership.
And for the information of our listeners, the topic that Dr. Pravin Wijesinghe, in his capacity as a consultant plastic surgeon, is going to focus on is hand injuries. A very wide topic indeed. Without any further ado, over to you, Doctor.
Thank you. And as Fatima mentioned, hand injuries covers a big area. Why I wanted to talk to everyone about this is because this is the most common cause of admission to a plastics unit in Sri Lanka. So 90% of what we do is related to the injuries of the hand. And if not managed properly, they can have a devastating outcome for both the patient, their economic condition, and also life as a whole. Just a bit about the hand. Hand is, we take it for granted, but hand is a very vital and very complex structure. It's got many things, bones, vessels, nerves, skin, tendons, that makes the function of the hand possible. It's also aesthetic function. It's something that we see. That's why there are hand models, for instance. It's also an organ that conveys emotion. In fact, right now I'm moving my hand to stress on certain points. So the injuries of the hand is very common, as I was mentioning. Most are accidental, but it can be self-inflicted and also as part of a homicidal cause. They can be crush injuries, they can be lacerations, blast injuries, or burns in general. One of the most common causes of injuries to the hand is the industrial accidents. And industries in Sri Lanka has almost no safety protocols that are being followed. The first thing our people do, in general, I'm talking not always, but the first thing we do is we remove the safeguards from the machine, and also we don't wear personal protective equipment. So the injuries that we get as compared to some other countries are very bad. They are almost amputations or mangled limbs and such. Another common form of domestic accidents is knives. We use all age groups in Sri Lanka use knives, and in fact, one of the common causes of childhood amputations is when this child grabs a knife, tries to cut into a coconut, and by mistake hits the finger, and the finger falls off. So those are common causes of hand injury admissions. Of course, during the New Year celebrations and all these celebrations that uses fireworks, we get blast injuries to the hand. Thankfully, we are off the war scenarios in Sri Lanka. Otherwise, we used to get a lot of war blast injuries to the hands too. Thankfully, because of the price of the fireworks have gone down, we are slowly but surely reducing the number of blast-related hand injuries. You can also get burns, which is very common, especially hot water burns in kids, and that's another cause of hand injury. In the hospital, when they come to us, we assess them, and then we start repairing them in a sequence. But what is important to realize is, more severe the hand injury, the rehabilitation process is in weeks, not just a few days. So you can imagine a daily wager getting a hand injury. They are stuck with that injury for a minimum of 6 weeks if the right structures are affected. So it's important that they come in early. So what we tell everyone is to seek attention early or immediately. Wash out if there is a lot of contaminants like mud or grass or animal fecal material. Just wash it out, cover it, and seek medical attention. That's what we ask from our patients, especially in diabetics and also the immunocompromised, like cancer patients, for instance, or kidney patients who are inherently at risk of infections. An infection in the hand is bad because they progress rapidly into the severe infections where we end up removing the hand at times. So we always tell them to seek medical attention immediately. Why am I stressing on this? I'm stressing on this because there's an immediate functional impact. You can imagine a person who uses a pianist, for instance, or a manual worker, for instance, who pushes a cart for a living or does something. I mean, we all use our hands, and we are human because of the ability to use the thumb and the hand. So there's an immediate functional impact of having a hand injury. If there is an infection, I mean, where the patient has not followed or had not sought medical attention, the infection can spread proximally into the forearm, and we can get very, very bad outcomes from that. There's also this scenario where the hand injury might be trivial, but the damage inside might be significant. A lot of patients don't seek medical attention immediately, but they wait for a little while and find out that, oh, look, my hand is not moving as it should. The issue at that point is, if the patient came to us initially, let's say for a tendon injury, the course of therapy is about 6 weeks. It's long, but if they come in late, the course of treatment is about 6 months. 6 months of that patient's life is affected by this hand injury. So, as I said, when I said a hand is complex because of the structure, so hand injuries could be a fracture. You may not find anything outside. All you might find is just a swelling, a bit of pain, and when you move, the finger moves in a weird way, that could be a sign of a fracture. A small puncture in the hand could result in a tendon injury, and all you can say, all the patient will see is the patient can't move a certain joint or can't move a part of the hand. And another thing that the patient might find is if he cannot feel a part of the hand, that might be the sign of a nerve injury. Or if the hand injury is very, very severe, the hand might be completely mangled. We, as hand surgeons, all plastic surgeons are hand surgeons. All hand surgeons are not plastic surgeons. There are orthopedic surgeons also that do, trained orthopedic surgeons who also do plastic hand surgeries. We make sure that these patients are rehabilitated as quickly as possible with the best outcome. And that's why we keep telling the patients to come in early so that those bad outcomes aren't possible. A little bit about amputations also. Amputations are very common, unfortunately. It could be just the tip of a finger, it could be a finger, it could be part of the hand, or it could be the entire upper limb. And these are very common, especially in these industries where rotating blades are there, like printing presses, circular saws, grinders. Unfortunately, we have a culture, and that seems to be on the rise, where the simplest argument results in somebody drawing out a sword, and the person who comes in front first gets the brunt of it. And we get a lot of amputations where somebody has been assaulted. This is in fact, the plastic surgeon's name is drawn towards this reimplantation of pieces that have been amputated. The surgery is called reimplantation, and if the patient is brought in time and the part that has been amputated has been brought in the correct way, these generally can be reimplanted. When I say it can be reimplanted, there are conditions where we cannot. One such scenario is when the whole piece is totally crushed, like a printing press accident, or a common scenario is where the rubber industry, where the rollers are being used and somebody would put the hand through and the arm comes off, but then we cannot sort of reconnect that. If it's very, very, very distal, like a tiny tip of the finger, may not need a replantation as such, and maybe we may not be able to either. The other condition is where there are medically complicated patients, like a diabetic patient or a severe asthmatic patient or a terminal cancer patient who's got an amputation. We may not be able to do this complex surgery because it takes a long time and takes a lot out of the patient. And these once we do a reimplantation, the recovery is about a year. It's not even 6 months now. Also, when there are other parts injured, so let's say there's a chest injury and an abdominal injury, there are multiple stab injuries to a patient. Obviously, we are trying to save the patient first before trying to save the limb. So we may not do in that scenario. But in all other scenarios, we should be able to generally take care of that piece and also reimplant that piece back to its more or less the original condition. So the key question is, how do you bring, and I think this is the message I want to send out to the listeners, how do you bring a piece that has been amputated, whether it's a finger or an arm or a hand? First thing you do is, if it's dirty, you wash it once. You don't need to wash it. Just wash it once. You don't need soap. Just wash it once. Put it into a clean bag. The bag has to be tied watertight. It cannot be a leaky bag. It cannot be an open jar. No, it has to be a watertight bag, and there should not be anything else inside the bag. This bag is put into a slurry of ice. What I mean by slurry is there should be ice and water. You don't want ice in, because ice in touch with skin will kill the part. When you put it into a bit of water and ice, it surrounds the part and cools the part, so it doesn't start dying as quickly as it otherwise would.
That's very interesting, Doctor, that if one does lose a part of the hand and you want to reattach it, right? You want that, because this process to be followed, because you're trying to reattach that particular part that has got dislodged from the hand per se, whichever part of the arm. So I hope our listeners will take note of the fact that if that is the case, and if you're around, the part of that has come off has got to be put into a watertight bag with water and ice. How much of water, how much of ice is submerged in it, or is it, how does one keep it in?
It should be submerged. Of course, this is a issue as when the piece of the amputated part is bigger. I mean, I had a patient that brought his entire arm. They did it very well. It was cut in at the fish market in Paliagoda. So he took a garbage bag, wrapped it in watertight, and then took the ice from the fish market, put it in, and then covered it with water. So the cooled ice preserved the limb, and we managed to fix it. What is very important is, especially with the upper limb, it's not as much with the lower limb. Of course, the same scenario is for the lower limb too, but especially with the upper limb, the functional loss cannot be regained by even the best prosthesis available, especially in Sri Lanka. But even in the world, even the best prosthesis that's out there does not do as well as a re-implanted limb. Even if it's a small piece, like let's say the thumb. 80% of our hand function is because of the thumb. Otherwise, we are basically good-looking apes. When we lose the thumb, we lose 80% of our hand function. So if the thumb is cut off, thumb reimplantation is almost an emergency. It's an urgent thing, not just to save the piece, but also to save function over a long period of time. So those pieces have to be brought, and when you put that into the slurry, it has to be brought in quick. No time wastage. And if you can, inform us so we are ready for you, so we can start as early as we could to start connecting these pieces back together. The other thing is, keep fasting. Don't have a packet of rice on the way to the hospital. This surgery is more or less going to be done under general anesthetic, and we'd like to have you fasted for it. We can operate on you even if you're not fasting, but the safety is much more if you are fasted for 6 hours. So let's say you're coming from Batiklo to Colombo. You don't need to harm there in Batiklo, but if you have to, make sure you're fasted. Don't have a packet of milk on the way. Bring yourself to the hospital fasted, clean bag, watertight, in a bath of ice.
Thank you, Doctor. Good advice there, and I hope once again our listeners will take note of the explanations given by Dr. Pravin Wijesinghe. In the event of a part of your arm any part that is, and to whatever extent there's damage and it's lift your arm proper. That's what you mean. And you need to be reattached. It can be reattached. And to do that, ensure that that particular part is put into a watertight bag with water and ice, submerged in water and ice. And for the person per se, do not have anything because you're going to undergo surgery. And as a planned surgery, you are fasting.
Yes.
You're made to fast if you're going under general anesthesia.
Yep.
And in this instance, it's going to be general anesthesia. There's no plan. So en route to hospital, whatever time that it takes, best that you don't take any form of food or drink.
Yes.
So that's good advice for our listeners in that respect. So doctor, now these surgeries you say are so common in Sri Lanka. And it's difficult to imagine that so many people come with these, come to a plastic surgeon.
Yep.
90% of the cases you handle, which is at the outset, are related to the hand.
Yep.
So the rest of the body, vast body of a person, is not that badly affected injury-wise as the hand is. So taking that into consideration, how does one protect one's hand? I mean, we are as you said, we're using it all the time. I mean, you're talking to me, you express yourself while you're speaking, you tend to use your hands. A speaker at a podium is addressing a gathering, but he or she will also use his or her hands to express a point or to stress a point. And we do it all the time. Yeah. How do we protect our hands?
Stick to the safety protocols. If you are not a trained person, try not to use power tools. Power tool injuries are less here than in, let's say, the West. But when they happen, they are way more dramatic here than in the West. Because I've never had a patient come to me in the West coming and telling me, look, I've not been wearing gloves when I did it. They almost always wear it. The other thing is, most of these equipment have their built-in safeties. They have their guards. They have automatic shutter. Don't remove them. They're there for a reason. I had a series of patients that came from printing press accidents. Almost all of them had removed the guard that prevented them from putting the hand inside in the first place. Just to cut corners and do it faster, quicker, probably a little bit more efficiently, they've removed the guard. And those crush injuries are not just a fingertip injury, they are basically the ruin of the whole hand. So, I mean, do not remove them. Ensure that there is a compensatory protocol in the place where you work. If it's a company, the companies help recuperate both financially and also physically these patients in some countries, most countries. But in Sri Lanka, not many companies would sort of help them through. And when they lose their livelihood, they've lost it. There's no compensation, there's no insurance protocol as such. So I think we as a country should strive to do it. What you need, do not cut corners. I mean, it's just good practices. It's not rocket science. It's just good practices. Be safe. Follow those. And also, when it happens, come to the proper place to get it sorted. At the wrong place, the wrong surgery done by the wrong person could have devastating consequences on these hands and then their lives.
As a matter of fact, doctor, whilst we're not going into the technicalities of injury in the sense of the treatment in terms of surgery, because I mean describing that is not going to be of much use. That is something that you have to do and you will do it. So the idea here is to bring awareness to the listeners on the precautions they need to take, and if an accident does take place, what they should do. Now, like most other accidents, doctor, you have this time frame of getting to a hospital pretty fast. How much of that is applicable in this instance?
With regards to amputation, you need to be there as soon as possible. Now, there are places where you don't find plastic surgeon. Let's say Mullathir, for instance. But there's a plastic surgeon in Jaffna. There's a plastic surgeon in Anuradhapura. So if you go to that hospital, they will trans you as soon as possible. So seek medical attention early. If it happens in the night, especially in amputation, you should go in the night. Do not wait till the morning, because there's a thing called ischemic time. When the blood supply to any part of the body is cut off, there's a certain amount of time that the body can survive without that blood supply. And that's about 6 hours. So if you stay longer, the outcome of the surgery, even if you do it, is going to be bad. So you need to seek medical attention early. If it's not an amputation, even then, a skin breach, a wound is basically a breach of your defenses. Skin protects us. You can get really bad infections, especially if you're diabetic. Those infections can make you lose a finger, a hand, sometimes your life. I've had patients lose their life simply because they went into sepsis following a hand injury, which is really sad to say that it's happening. So seek medical attention early. If it's an amputation, immediately. But if it's an injury, as soon as possible.
Because that is applicable to any injury.
Exactly.
But as you say, sometimes the mindset is such that one might think, well, we'll do something in the house, tie it up, do whatever, wrap it up, and keep it going, and then come to the doctor in the morning. Go to the hospital in the morning. So you lost a lot of precious time there.
Yeah. Morning is better than never, but as soon as possible is what I say. So if it happens in the morning hours, come at that time. If it happens in the night, if it's not an amputation, come in the morning. The simplest dressing that you can do is just wash it with soap and water and put a clean piece of cloth around it. You don't try to put... We as kids used to put coffee leaves. I don't know why we did that. But then that's what is being told to us when we were younger. Yeah, especially burns. I think I've spoken about burns a while back. But burns, don't put toothpaste. That's the commonest thing that's put on burns. Do not put toothpaste. It doesn't work. It doesn't serve any purpose.
Well, Doctor, very interesting. And talking of coffee, yes, I think that was something practiced in this country long time ago, and sort of like a home remedy, which is definitely, I would say, not accepted favorably by the medical fraternity as a professional doctor. I mean, you certainly wouldn't advocate that. But, well, it doesn't happen now, so I think we don't have to worry. So going on from there, just time is catching up with us, and I'd like to ask you, Doctor, of these categories, I mean, you did speak of basically the industrial sort of injuries. So that means it's the adult population that is affected. And back again, like the other traumas, it might be the productive age group.
Exactly.
So what would you tell them before we wind up?
It's almost always the productive population. But having said that, there are pediatric patients that do get admitted. You can imagine a toddler going around, putting the finger in between the door jamb and the door, and then you're going to get a crush injury. And that's pretty common. That's actually the commonest cause of pediatric hand trauma, a crush injury to the fingertip. But yes, more often than not, it's generally the adult population that come in. I get about 5 patients a day in Vaticlo. And those are the patients that do seek medical attention. Those are the patients that get referred from the other hospitals. But there are a lot more out there. But I also, before we go off, what I want to say is, there are patients out there who've had injuries in the past, never sought medical attention, but they've got issues with their hands. Do come and see us. We might be able to help you. It's always better to get that surgery done as quickly as possible, early, but even at a late stage, we might be able to help you. So do come and talk to us. We will try to explain to you what you have and what can be done about it.
So that's very important, listeners, that you seek a proper medical attention. The medical attention you need is that of a plastic surgeon or an orthopedic surgeon.
Whoever is trained to do
exactly hand surgery. So that is very important that that is kept in mind, and such professional help is sought as against just going to any other surgeon, because it's vital that the proper procedure is adopted to treat the injury for total recovery, or as best recovery as possible, and for the best use of that limb in the future. So, Doctor, your take-home message?
Take-home message is seek medical attention early. Do protect yourself. There are inherent protective protocols in place. Do follow them. When you do get an injury, seek medical attention early. And also, if you have an amputation, protect the piece that you bring, and I've told you how to bring it, and seek medical attention as soon as possible.
And a message to the management of organizations regarding the equipment they have to prevent their workers or anybody who might remove these safety devices or the safeguards that are in place.
Make sure that you have strict protocols to run a particular machine, especially ones that have moving parts. Make sure that all the staff follows a safety protocol, gloves, helmets, protective eye goggles, things like that. Make sure that it's enforced. I think then we should be able to reduce the number of hand injuries over time.
I hope so, Doctor. Thank you so much. And on that note, we end this very interesting discussion on how hand injuries happen and how they're treated. And also importantly, what the public needs to know to seek prompt medical attention. Of course, 100% follow all the safety protocols. Thank you to you, Dr. Pravin Wijesinghe, Consultant Plastic Surgeon, Teaching Hospital, Batticaloa, for being with us on the program. Truly appreciate it, Doctor.
Thank you, Fatima. Thanks.
My thanks also to Harshani Vanaguru for technical assistance. Thank you, Harshani. I'm Fatima Razikada saying good night and hoping to catch you next Monday, same time on Views on Health.